call to order this meeting for Wednesday, April 1st, 2020. Carl, can I get a roll call, please?
Councilmember Remley.
Here.
Ronayne.
Here.
Lunsman.
Here.
Rife.
Here.
Johnson.
Here.
Bunceness.
Present.
Olson.
Here.
Rux.
Here.
Mayor Shoneman.
Here, please stand with me for the Pledge of Allegiance.
Allegiance to the flag of the United States of America and to the republic for
which it stands,
one nation, under God, indivisible, with liberty and justice.
justice for all.
First order of business will be discussion and possible second reading of the emergency ordinance number 1 regarding the novel coronavirus COVID-19 public health crisis. This is the ordinance that we passed last week on Wednesday. Can I get a motion?
Moved. Second.
A motion from Bunceness and a second from Rux. Nothing has changed about this ordinance since it was read last week. Does anyone have any discussion or questions as it relates to this second reading? Otherwise, Carl, give me a roll call vote.
Councilmember Remley.
Aye.
Ronayne.
Aye.
Lunsman.
Aye.
Rife.
Aye.
Johnson.
Aye.
Bunceness.
Aye.
Olson.
Aye.
Rux.
Aye.
Mayor Shoneman.
Aye, motion does carry due to the immediate implementation of this thing due to the emergency status of the bill. This will go into effect at 12:01 a.m. tomorrow morning. Next, we've got discussion and possible first reading of emergency ordinance number 2 regarding the novel coronavirus COVID-19 public health crisis. Can I get a motion?
Move to approve.
Second.
Got a motion from Ronayne and a second from Olson. Looks like we've got a potential couple of amendments to chat through here. Councilman Ronayne.
And I would ask, can the city attorney please, you've got my amendments to?
I do.
Or will we lose these folks on?
We will lose the folks on Zoom, but
They can
you
still
folks
hear.
will be able to see it. We'll just pull them back in when we switch.
Perfect.
They can still hear, though.
So I
Gene,
move,
can you switch the screen now, please?
Mayor, do you want me to move my amendment before he explains it, or may I do so afterward?
Why don't you explain it first, would you?
Thank you.
The first amendment, if we can keep it in this order, Councilman Renane, would be amendment that is being shown up on the screen, and it would consist of changes to paragraphs 2 and 4 to delete the language "and cease operations" and substitute in its place the following language: to on-site sales, comma, but may continue to offer products for sale off-site under the same conditions as bars and restaurants outlined in paragraph 1. So we would make those changes to paragraphs 2 and 4. Minor changes throughout the document to take out the abbreviation of para and complete it with paragraph. And then the last amendment at this time would be to add in paragraph 5, which is identical to the language in paragraph 2 of the emergency ordinance number 1 that the council just finally adopted. So paragraph 5 would be a repeat of that language, and that would be consistent with the executive order from the governor requiring councils to restrict groups, public gatherings of 10 or more people unless they followed CDC distancing and hygiene practices.
Ron, from a general rule of order here, when this becomes adopted, will the first one need to be repealed, or will that automatically replace the first?
When this one is adopted at second reading, it would not necessarily repeal the first one, the first emergency order. We're going to call that emergency order number 1, and this one that you have before you is emergency order number 2. What the council would need to do is actually do nothing by having a meeting, whether it's a special meeting or a regular meeting, and not passing a resolution extending that. That language that I'm talking about is in both ordinances, and would require affirmative action by this council at every meeting to pass a resolution to extend either or both ordinances, for that matter. But it would become a little incompatible to have the two out there, so you would want to let one go and repeal and keep the other. So that's the major in play, but this would be the first package of amendments that I'm explaining to the council.
So I'm offering those amendments on behalf of Mike, Josh, and myself.
Move, second.
So I've got a motion from Ronan and a second from Bunceness to make the first set of amendments listed as red line for Mike, Josh, and Rob. Does anyone have any questions for those gentlemen? Clint, what have you got?
So under this language, a couple of businesses have talked to me about, let's say, selling gift cards. So a person comes in and purchases gift cards. Would that still be allowed for a person to come into the building, just one person, under the changes to that ordinance?
Here's what I will tell you, in that there is the continuation of takeout, delivery, curbside service, and drive-through service. That's what the change is intended to cover. So whether it would include gift cards, I think it's a matter of how long the patron is in and how quickly the transaction is completed and the patron
Typically
is out of
5
the
minutes
store.
and under, typically.
Yeah. So I would think that type of activity could fall arguably within the permitted operations that are
Okay.
set forth in paragraph 1.
Are there other business activities that anyone would think might be reasonable but yet not allowed under this, the way that this thing is phrased?
I think the debate is supposed to be only as to this amendment, and maybe you are questioning whether there ought to be an amendment to the amendment. So
That's fair. Well, why don't we take, with that discussion, I guess, we'll take a voice vote on that amendment, labeled red line for Mike, Josh, and Rob. All in favor of making this amendment, please. Oh,
Excuse me, Mayor, because we have people like,
Nope.
well, I guess all the voting members are.
Yeah, all the voting members are here.
I'm already into the teleconference mode, sorry.
you're forgiven this time. All in favor, please say aye.
Aye.
And opposed, nay. Motion does carry. The first set of amendments has been included. Councilman Ronan?
Thank you, Mayor. And now I would ask that the city attorney present the second set of amendments that I'm presenting on my own behalf today.
Council, you'll see before you is the document that with the changes that you just approved have already been incorporated into this. And this,
We need Gene to change over.
what's that? Oh,
Yep. There you go.
thank you, Gene. So this is the document, the ordinance that you just amended, and those changes have been incorporated. And now we're looking at two new possible amendments. One is at paragraph 2, and that is to add before the listing of recreational facilities, pools, health, and those, add the word indoor to make it clear that the closure that is being required, closure to on-site sales, is for indoor recreational facilities, pools, health and fitness facilities, etc. So that's the first change. The second would be to add in a new paragraph 5, consistent with the language that we've seen in the others, but to identifying tattoo parlors, beauty and hair salons, spas, massage studios, and other similar indoor hands-on personal care facilities would be directed to close to on-site services and sales, and they could continue to operate for off-site sales consistent with what we're seeing with the other provisions. So those would be the two amendments that Mr. Ronan has as his package.
And I would move those amendments.
Second.
Got a motion from Councilman Ronan and a second from Councilman Olson to accept Ronan's amendments and indoor facilities as listed on the sheet above. Does anyone have any questions for Councilman Ronan as it relates to any of these, or perhaps the city attorney?
Hey, Gene, can you keep that on, please?
Otherwise, I will call a voice vote. All in favor of it?
I think I'd like to make a comment before we proceed to the vote. You know, in the last week, I've had an annual physical administered by an Aberdeen area physician. I've had my haircut provided by an Aberdeen hair salon. And in both cases, the signage leading up to that service given was, I would say, nearly identical in the protocols that were being followed. There's also the services that were provided to my person were in similar proximity, and the attention given was, with or without PPE. It was without in both cases, and I think that this might be strong that we are implementing paragraph 5. I would prefer that to be left out, considering that in both cases, a physician and in this case, the people that provide salon service, many have already closed. Those that are choosing to are being very careful with the protocols the CDC recommended, and in my opinion, should not be shut down. So I'm going to vote in opposition, using that anecdotal evidence that there are similarities, very careful execution of the recommendations that we're asking people to take that are already being implemented. So that's my position here.
Councilman Ronayne.
Thank you, Mayor. I've received since Monday 6 messages from people that are involved in hairstyling salons, and to a number, each one of them has asked that we enact this type of an additional prohibition. And the reasoning was frankly several-fold. Number one, I got from one of the individuals who contacted me, she said, I just had some folks in from Britain, and I could have this disease. These folks were older. I could have this disease, and I could be passing it on to them and not even knowing it. I perform 30 haircuts a day. I interact with 30 people in close proximity. These are not people with whom I am residing. These are people that could either be passing the virus to me, or I could be passing it to them. She said, it is inevitable that one of us involved in this kind of business are going to become among those who are involved in community spread. But the other thing that she said, and I think, by the way, that Todd Forkel is on this call in part to enunciate his support for this type of a prohibition. But the second thing she said that I think is very significant is she did observe, as you did, Alan, that many of her competitors have closed. She said that she has also inquired as to the availability of unemployment compensation if she closes. And she's been told that she's not eligible for that unless we force the closure. And if we force the closure, then she's able to get that. At this point, she doesn't have the option. She needs to work to feed her family. If we close her, at least she's got unemployment compensation to fall back on. And so she's among those that have asked that we pass this amendment.
Councilman Rux.
So let's say at some point we want to, let's say, pull off some restrictions. Would it still take 2 readings to change it, or through, so let's say, 4 weeks or 5 weeks from now, it's like, okay, our numbers have stayed steady, or, we haven't had huge increases like certain other areas of the state. Can we ease up some of this stuff in the ordinance, or will we have to pass an ordinance each time taking sections out?
The way we've structured this ordinance and ordinance number 1 would not permit you to do kind of a cafeterial style of selecting items off and keeping those in place and taking others off. It's either an all or nothing approach to these ordinances and to these social distancing measures. So the resolution that by the ordinance that you are approving or not approving asks 2 questions. Is there a continued existence of the public health emergency, and are the social distancing measures still necessary? But it doesn't give you the ability to peel off ones that may not be.
Okay.
So you would be bound to approve all of them or none of them.
Councilman Lunsman.
So if we decide to pass, this is the first reading, next week we do a second reading. If it passes second reading, we could technically do the same thing as tonight, is actually have a first reading on a least restrictive and not have a second reading for, say, 1 week, 2 weeks, or 3 weeks?
Sure.
Is that possible?
That's
That way we would have the option at any moment, as long as we fulfill that 5 days, right? We could hold an emergency meeting and pass that second one, couldn't we?
That's correct.
I guess that's what I was alluding to. Thanks, Dave, for.
Councilman Ronan, I'm curious, did you verify that, because was it posed to you as a question about the unemployment, or it was stated as a fact?
It was not posed to me as a question. She stated to me it was a fact. And I also believe the young woman who was here a couple of weeks ago, who was also a hairstylist, expressed the same thing, that she could qualify for unemployment if we forbid this activity. But I've not independently verified that,
Sure.
although I tried.
Okay. I'm curious. People had asked me that question as well, and I checked with the SBA about the programs available, and those ones were not contingent on it, but I didn't check with unemployment. My understanding is most of these hairstylists are independent contractors and probably not qualified to receive unemployment.
The new law that passed, so it does make certain exceptions for
Independent contractor.
certain types of individuals, like those who work for Lyft and all that, were never qualified for unemployment. They can qualify under this, as well as certain contracted employees. There's a lot of changes in that law, and they could always at least go through the unemployment office, and then they'll determine their eligibility.
Councilman Rife.
This is kind of obviously new territory, and I'd like to, since we have them available, maybe get some input from the health professionals that we have on the Zoom call, from Mr. Forkel and also Ashley Erickson.
Could we dispose of this amendment first and then have it on the main motion?
Well, I'd like to get their opinion on this
Dispose of
amendment.
it, but vote on it?
Well,
Or do you think it's
Well,
valuable?
the information I want is about this amendment specifically.
Okay.
Hairstylists, massage therapists,
Okay.
things like that.
Okay.
Todd, you're on.
Great. So thank you. I appreciate, Lynn, you setting this up so we could join in this fashion. And I appreciate the mayor and the council for their engagement. I have a great deal of respect for all the opinions stated. So I certainly want to qualify my statement as that. I believe that it is a public health protection to move forward with. I don't see it. I'm not able to see the language, but from what I've heard of the more restrictive language, just because of the days where you have the virus and you're not symptomatic, there's a high probability for unintended exposure. And so I think they're not easy decisions. I clearly understand you're impacting people's lives and their livelihood. But I think in this case, the public health crisis prevails. You know, we just finished March and I saw some statistics. March 1st, there was 71 positive cases in the US with 1 death. Through last night at midnight, 186,000 positives with 3,800 deaths. And that's with us not having the ability to test mass wide just because of the availability of tests. So, and yesterday at the press conference, Dr. Fauci of the CDC said, and I put this in quotes, he said social distancing works, and in quotes, there's a glimmer of hope for those communities that they're now seeing are starting to see them actually flatten the curve through this. So I think it's a tool that science has showed is work. We're in a pandemic. While I respect everybody's opinion there, I would certainly advocate for the stricter measures.
Thank you, Todd. Ashley, since we've got you, have you got something to add on this particular amendment?
Yeah, to echo that, again, difficult decisions, but leaning on the stricter, again, in hopes that if you can take the stricter route right now, it should help us progress and hopefully open things up sooner, would be the approach I would suggest. Also, when you look at the data, the statistics, how other city, counties, and states around us are approaching salons as an example, they've taken those measures, not all, so I don't want to misrepresent. But when you follow those CDC guidelines, we're all trying to be as preventative as possible. But as Todd alluded to, you're not systematic for a few days. And at that point, most likely you've already spread the COVID. And that's what we're trying to prevent right now, again, to slow that surge of patients, right? It's here, it's going to be here. That's the reality. It's just how do we now make it more manageable on the healthcare sector so that it's not all at once. So thank you.
Thank you, Ashley. We appreciate it. Councilman Lensman.
Just to add on there, and granted, I'm not a professional in this arena either, but I did speak to a doctor that echoed most of what they both stated, was that the social distancing is what he's recommending. A local doctor here stating that all the everything that he has seen also is where we need to social distance. We need to flatten that curve, just like they said. And he said his concern is not only for COVID-19, but also for the normal everyday, the cardiac arrests, the other things that just happen in the community. If you get overrun by COVID, what do we do with the other patients that are having their other health issues, whatever they are, that are emergencies? And at some point, we're going to run out of the ability to help them. So his recommendation is to do everything we can right now to avoid this later on.
Thank you. Councilman Rux, real quick.
I think there's also the other factor to this too, that what happens in Aberdeen has a larger impact than just in Aberdeen.
I guess I do.
Like Rob said, you have people coming to get their hair cut from Britain. People are coming to get their groceries from, Ipswich, because there's just no locations in those communities to get those services done. And so if we have someone spreading it who may not be symptomatic, who spreads it, it may be spreading it to as well as other counties as well. So this could be a bigger health problem than just an Aberdeen type thing as well. So, because if those places are closed in their towns and they can come to Aberdeen, they're going to may come to Aberdeen, and then they could get the virus here and then spread it to their own communities as well.
Councilman Bunceness, did you have something to add?
Yes, I'm going to support this amendment. I'm going to support the main motion, and I would support what Councilmember Lunsman had suggested, that we bring something back and that's less restrictive, maybe a stair-step approach, and so we can take action. We need to do this. Monday night was an eye-opener for me. I was one that said, let's take it slow the previous week. But Monday night, listening to the professionals and then talking to two doctors today, tells me that those two doctors are very concerned about where this goes. And I think for that reason alone, we should be doing this. We need to protect our healthcare system, and so it doesn't get overrun. So I'm supportive of this motion.
Thank you. We've got a motion and a second. All in favor of Ronayne Amendment and Indoor Facility Addition, please say aye.
Aye.
Opposed, nay. Motion does carry. Is there any further discussion about the ordinance itself? Councilman Lunsman.
I'd also like to just add one more amendment on number 5, right after hair salons, to include barbershops. They are separate, and we need to make sure we identify them separately.
Second.
We've got a motion from Lunsman and a second from Ronayne to make an addition to the language in bullet 5 to include barbershops. Does anyone have anything to add about that? Otherwise, we'll take a voice vote. All in favor of adding the term barbershops to bullet 5, please say aye.
Aye.
Opposed, nay. Motion does carry. Is there any further discussion on the first reading of emergency ordinance number 2? Councilman Olson.
Thank you, Mr. Mayor. Been some great discussion on this issue. For years, as I recall in my memory, which goes back quite a ways, But there was always a feeling that we didn't want the federal government or state government telling us what to do in our communities or in our schools. And we were always against that. And now it's right in our lap, just the way we kind of wanted it in the past. We could have followed the direction of our governor, but she chose not to declare an emergency and close these things for us. And so we're left with this huge decision, a very important decision, one that we all took an oath to do, to protect the health, safety, and welfare of our community. I agree with Mr. Busness on Monday night's presentation by our healthcare professionals. It was certainly eye-opening. I wish we would have passed this stricter ordinance last week, but I support my colleagues. The majority chose to go with the lesser. And so tonight, we have an opportunity to try to stop, at least slow, any future spread we may have of this virus. I look at it as a way to defend our community. Here we sit. We have an opportunity to defend our community, and this is an opportunity for us to do that. And so I am very much in favor of these strict restrictions because of what our community faces.
Thank you, Councilman Olson, and I appreciate the fact that you brought up the point about local control. I totally echo that sentiment. I think that it is something that we're better served if we can make these type of decisions on a local level than someone in Pierre or in Washington, D.C. Councilman Reif.
Thank you, Mayor. I've done as much reading on this topic as I could, and one of the articles I read, the author said that uncertainty can bring with it a loss of hope, and we are very much in uncertain times. And I think it's important that the community recognizes, as we all do, and as Ashley alluded to, that this affects a lot of people very negatively. People will be losing their jobs potentially. Businesses may close. That's just the reality of our situation. I think it's important for the community to come together and do what we can to help the people affected. Before the meeting, I called Aaron Schultz, the director of the United Way, to ask him if he will come to our meeting on Monday and talk about ways the community can help those that are affected by this. I think that's just an important role for us to take as well in this. So,
thank you, Councilman Reif. I know that COVIDHelpSD.com has been gathering names of people that are in need of help as well as people that are volunteering. I've added my name, and I would encourage you guys to do the same. There's a lot of people that are elderly or infirm that will need people to be running groceries and other tasks to keep them out of the public. Councilman Lunsman.
Just one real quick thing is when I was talking to one of the individuals today that happened to be a doctor, he stated, I can treat one person at a time. You guys have the ability tonight to possibly save hundreds of people in one fell swoop. I think we've done that tonight. It's not easy. I know we all have to face somebody that's going to be hurt by this, and I think it's the right thing to do for our community.
And I think it goes without saying that we represent people in this chamber, and I would say that by and large, the majority of the people that are being outspoken in this topic wish to close bars, restaurants, and casinos and so forth. So it's our responsibility to represent those people.
one more thing.
Councilman Reif.
Ron, can you, just for the public watching, can you address the letter Mr. Hoven sent out prior to this meeting? Did you have a chance to read that? If not, I can paraphrase.
The
Go ahead, please.
Josh.
I'm sorry.
Yeah.
Playgrounds.
Playground.
Closings?
Yeah, do you want to?
Well, Lynn and I have been in conversation. There's been quite a lot of discussion online and in personal circles about the use of playground equipment. A number of other communities throughout South Dakota have put very strict restrictions on the playground equipment, perhaps leaving the rest of the parks open, but preventing people from utilizing equipment because that a lot of hard metal surfaces that are potentially containing this contaminant, as well as a disregard for lack of social distancing. And so that is something that will be addressed in the upcoming Parks and Rec board discussion next week. So it seems like that's something that will be discussed, and perhaps we will take similar measures to Brookings and Rapid City in that respect. Does anyone else have anything to add before we take a vote on the first reading of ordinance number 2? Well, thank you guys all for coming here on a Wednesday. I appreciate that. Carl, give me a voice vote, a roll call vote.
Councilmember Rux,
Aye.
Olson,
Aye.
Bunceness,
Aye.
Johnson,
Aye.
Reif,
Aye.
Lunsman,
Aye.
Ronayne,
Aye.
Remley,
Aye.
Mayor Shonneman.
Aye, motion does carry. Does anyone else have anything to add before we adjourn?
Yes, sir.
Councilman
First, I would ask that the mayor call a special meeting to consider second reading of the second ordinance on this coming Tuesday at 5 or 5:30, as the mayor sees fit.
So I would, at this point, call a special meeting next Tuesday at 5:30. And Councilman Rux.
Nope, then that's fine. I was just going to have Ron just sort of sum up since we passed the first one and had its second reading, what happens at 12:01 a.m. basically tonight.
Thank you, Councilman. Tonight, just to be clear, the emergency ordinance number 1 is the ordinance that tracked more closely what the governor's executive order was from last week. And tonight, at 12:01 a.m., any enclosed retail business operating as a bar, restaurant, brewery, cafe, casino, coffee shop, recreational or athletic facility, health club, entertainment venue, or other similar place for public gatherings shall not permit 10 or more people to be in the enclosed facility where there is not sufficient space to have physical separation of at least 6 feet between persons. And they'll also be required to discontinue business practices incompatible with CDC hygiene practices designed to reduce the likelihood of spreading the COVID-19 disease. So this is what tonight's passage and final adoption of number 1 does, I'm sorry. They're also allowed to have certain business practices that do not involve public gatherings in an enclosed space, and those would be limited to takeout, delivery, drive-through, curbside service, and off-site service. Secondly, any public gathering of 10 or more people is prohibited unless there is sufficient space to have physical separation of at least 6 feet between persons, and where CDC hygiene practices, where CDC hygiene practices are not being followed. So you must have sufficient separation and follow CDC hygiene practices. This order does not apply to places of public accommodation that offer food and beverages for off-site consumption, including grocery stores, markets, retail stores that offer food, convenience stores, pharmacies, drug stores, and food pantries, room service in hotels, healthcare facilities, and those type, daycares, crisis shelters, homeless shelters, and emergency facilities necessary for the response. So again, that is what tonight's final adoption of ordinance number 1 accomplished. And that's effective at 12:01 the next morning here. I would also add to the council, I understand that if there's any interest in pursuing a less restrictive ordinance, having done this now twice, I think I'm finally gonna maybe do something better this third time, where I could probably try to fashion language that would allow you to repeal just portions of it. At the time that I was putting this together, I wasn't thinking along those lines, but so if we did have a third ordinance, emergency ordinance number 3, then maybe I could refine that language to allow you to do more cafeteria style as far as repeal or not repeal of certain provisions. So we wouldn't have to keep rolling a bunch of ordinances, we could maybe do it in that fashion. So I would put that up for the council if that's a direction you were inclined to go. I would probably put that language, something like that in.
Councilman Ronay.
Thank you, sir. I've got one more comment since I think we actually have a fair number of people watching this on television. We've got the press here tonight. So we've just passed what I think is a fairly strong ordinance that becomes effective tonight. It does not have the bright lines that the one that will be effective next week has, and I understand that there is some disagreement on what is permitted and what isn't permitted. For myself, I think it is impossible for a bar or a restaurant to operate even under the ordinance that becomes effective at midnight. But be that as it may, I would encourage the citizens of our community to act just as though the amendments, or the ordinance, I should say, that will be effective next week is enforced now. I would encourage our community to close bars, to close casinos, to close restaurants, to adhere to all of those recommendations that we have heard from these many experts who have come before us, both here in Aberdeen and also within our state and within our country. We all have a duty to keep each other safe. We have a duty not to spread the disease, and we can do that best by social distancing. For the City Council itself, I think we need to set a better example. We are gathering in groups larger than 10 in order to do the city's business, and I appreciate the city manager's efforts to allow us in the future to appear either by Zoom or telephonically. I would encourage that this council should figure out who's going to attend. If we need 5 people here on meeting nights, that's what we should have. We should have 5 here. We should have 5 appearing by telephone or Zoom or whatever technology we are able to gather.
Mayor, may I respond on that
Please
issue? By law, both state and our city ordinance, we would need to have physically present at the municipal building 5 of you to lawfully conduct business. That means the 4 of you could appear through teleconference, and that's fine. What I would also offer to the council is today, with the assistance of City Manager Lander and Finance Officer Alberts, we've been putting together a draft of an ordinance to permit teleconference, because that is not something that we're currently even allowed to do, to have a meeting that's all teleconference. And so we can put that language out. I'm not saying that that's something you would want to do, but it's something that you should have the option to do as that comes up. And that's language that we're working on. We can put that up as part of, before the council reasonably quickly, I would think, here in the next couple of meetings.
Councilman Bunce.
I had similar thoughts on the meeting, so we need to get together and decide who's going to attend for next meeting. I was very disappointed of the results of SB 191 on Monday. We have 2 representatives from the Aberdeen area that decided to vote against local control on this issue, and they need to be called out. That is just, it's inconceivable that you would vote against that. We need to have local control here so we can make these decisions immediately. We don't need political games. And so please, their names are Caleb Weiss and Drew Dennert. Give them a call. Let them know that this is wrong. We've wasted 2 days, actually 7 days, 9 days, because of their action. So consider the hospitalist that has to be in the front lines of this fight. Consider the nurses. Consider all of the other healthcare people that are involved. Their lives are potentially on the line here. And we just cannot be playing these games. I ask for the public to be patient. I think that's what this council is asking for. We've made big decisions. This is, someone asked me, this is probably the biggest decision that you've made since you've been on the board. And it's definitely the biggest issue that we've ever faced. There has not been another issue that we've faced to this level. But I would thank Ashley, Todd, Dr. Falk, and the two doctors that called today, because they did make this decision much easier for me to make. They just gave great information that tells us the severity of this issue. So, but we have not gone through something like this, and it potentially can be a period of time. So you have to be patient, and you have to physically distance yourself from other people. We need to do that here. We're poor examples. I agree with Councilmember Ronayne. So please physically distance yourself from others, and this will work its way through much quicker than if we don't.
Thank you, Councilman Bunceness. And I would like to add, maybe leave this thing on a high note. I think that hopefully this thing that we've passed here tonight, as well as the one that will pass tomorrow, will markedly decrease the spread of this virus in our community. I would like to thank the people of this community that have continued to do the right thing. Nearly everyone that I know has taken great measures to do the right thing, and I think that that's kind of the theme across our town. We're talking about a small group of people that have been disregarding the recommendations of the CDC and the Department of Health, and those are things that we can deal with on a council level, but I think that the fact that a majority of people in this community are doing the right thing have kept us on a positive track.
Good comments.
Is there anything else to add before we adjourn?
Two matters, Mr. Mayor. Number one, I think an open meeting is when you guys should resolve who's going to be here and who's not at the next meeting. So you should probably just do that right now.
Who has the capability of
Yeah.
zooming in? Okay, well,
I will be present here for any meeting, so that I'm able to, but. like I
should it
say,
be a rotation, or should it be just the same five?
Maybe it ought to be, maybe the two members from the same district, from the same area, they ought to decide amongst themselves which of them will be here. And so that we have somebody from Northeast at each meeting, somebody from Northwest.
Okay.
The mayor likely wants to be here for every one of them.
If you want to zoom in.
got the gavel.
Yeah.
Well, he's a young guy, and he's unlikely to.
I'm just gonna
I live
say,
next door,
we're
that's the
a little
bigger
younger,
deal, yeah.
but, yeah.
Yeah, I think that's a good solution.
Yep.
That's
Councilman
good.
Ronayne.
That's-
If the people within the same district were to just
We can figure that out.
arrange between the two who attends at each particular meeting, create a rotation amongst yourselves. The second point from you, Ron?
I just wanted to let the council know that because, again, you finally adopted ordinance number 1, you will have your first opportunity Monday night to pass a resolution extending it, knowing that you'll be having a special meeting then the next day to look at second reading and final adoption of ordinance number 2.
I also want to say, I know there's probably people, I've been getting the same emails everyone else has, that they want us to do something now. But remember, we're working within the confines of the law of having 2 meetings, and I echoed, I would echo Mr. Bunsen, some of Mr. Bunsen's remarks, as we wish the legislature would have taken a different tact and allowed us to pass this much quicker. On the other part of this too, as far as the council member chambers, when I came in, and I want to thank the finance office for thinking about us, but Jordan McQuillan actually brought the sanitizing equipment in, that they sanitize the ambulances, and did sanitize our council chambers. So thank you for, and so thank you for thinking of us in that respect.
Sounds good. If we have nothing further, I will take a motion to.
Mark's got something.
Oh, Councilman.
After this is all over,
let's consider giving this council a raise in pay. This is above and beyond the call of duty the last 2 weeks. Anyway, that's just my opinion.
Move to adjourn.
Second.
Got a motion from Bunceness and a second from Rux to adjourn. All in favor, please say aye.
Aye.
Opposed, nay. We are adjourned.
Thank you, everyone.
Thank you.
Thanks, Lynn.
Thank you, guys.
Ron, did you see that?